Can we just start? This is a very short session. It's a 45 minutes, the third in the series of FSM as a business. I'm going to be moderating the session. We have some three excellent presentations. One from Africa, two from Asia. My name is Dinesh Mehta. I work at the 7th University in India, where we've also been attempting to explore FSM as a business in some of the work that we are doing. So I'm really looking forward to some exciting presentations. For those of you who follow the program very strictly, there is a change. One of our presenters, Rachel, had a problem with her flight, so she cannot make it to this presentation, but she will make a presentation tomorrow. But we have to fill in for Rachel, we have David Ruben. So we'll have David Robbins' presentation and then take on the other two as per the program. David has been a senior septic management consultant. He's been working for Oxfam in the typhoon-affected Philippines. David has worked with RTI, AECOM, long years of experience. David, 10 minutes please.
Okay, thank you so much. Is that just a pointer? No. Okay. Yes, so there will be a business tie-in here, I promise. So when Typhoon Haiyan came through the Philippines, that was back last year, 2013, the year before last, sorry. Oxfam was actually one of the first on the ground. They do emergency response and actually longer-term sanitation improvement. But when that storm came through, Oxfam was there a couple days later, and they actually built a couple of line stabilization septic treatment facilities, because all these aid organizations came in and built all these toilets with nowhere for the waste to go. So Oxfam actually, in the central Philippines, is working in 14 communities. And this is the map of the central Philippines right there. The problem is that their money is limited, and if they were just going to dole out the money to these affected communities, they would only be able to cover about 6 communities. So we came up with the idea of a revolving fund, which spreads the money out a little bit farther. So a little bit of background is important. In the Philippines, septic management really means the regular and organized desludging for an entire community. And these are basically block by block types of desludging paradigms. And septic management is not new in the Philippines. Back in 2004, the Clean Water Act was passed, and it required that local governments or water districts put up septic management facilities. Now, they've been a little bit slow doing this, but they're making steady progress. But in 2004, when they crafted that law, the law gave the powers to the local governments that yes, you can pass an ordinance that requires people to pay fees for the septic services, or you can levy taxes, or both, whichever you think is necessary. Now, the concept of the street-by-street desludging is really important because we're trying to keep the tariffs as low as possible so people can afford them. And when you look at desludging block by block, neighborhood by neighborhood, the costs really do come down. You can do this in an organized fashion where the local community leaders can control the traffic, and then they can move the hoses and open the tanks in advance of the trucks, so the truck drivers can just focus on driving their trucks and doing the desludging. But this concept is really based on the concept that if everybody pays a little bit, it's really enough money to fund these programs. And we're not just talking the operation and maintenance, but also the capital expenditures as well. So the idea is also that this becomes considered to be affordable to people when they don't have to shell out all the money at once to pay for the service. If you're paying every month a little bit at a time, that's much easier from the affordability point of view. So here's an example from one of these 14 communities. This one is G1 in eastern Samar, and this is the community where Typhoon Haiyan first hit. And I think the storm surge was 10 meters, if you can picture that. That's probably about as high as, yeah, third floor of apartment buildings were knocked over by the storm surge. But this is the pro forma. Let's take a quick look. So they've got a coverage area, 6,300 homes. The average monthly consumption is about 18 cubic meters of water per month. They've got 700 businesses and institutional buildings, schools, etc. And those users are consuming about 20 cubic meters a month. So if you put a tariff on there of about 2.5 pesos per cubic meter consumed, that's about a nickel in US terms, 5 US cents per cubic meter consumed of water. And you add it all up, you're basically charging people about $1 a month, and your revenue is almost $8,000, which is about $1,000 more than it takes to pay off your low interest loan. So the idea is that that's what Oxfam wants to do, is make low interest loans, because the experience in the Philippines is that these are cost recoverable programs in about 4.5 years with these low tariffs when everybody can pay. So this is, again, we're Septage 101, but it's important because these are the three components of the septage management programs: low-cost treatment and collection technologies, promotions campaigns that are evidence-based and drive the willingness to pay for the services, and the supportive environment. And the idea is that when all these things come together, that's really when you can achieve the success. And when we talk about the supportive environment, we're talking about education of local staff at the government, we're talking about the fee schedule and a local ordinance that specifies the procedures, the rules, the regulations, and the penalties for non-compliance. And what's critical with this paradigm is that Oxfam will get involved once these three components have been identified and the local ordinance is in place. So we do a lot of capacity building in the first few months to work with the local government so that they can pass their local ordinance, and that guarantees the funds flowing back. So this is really how their revolving fund works. It's administered by a third party, because Oxfam really wants to get this going and then have an exit strategy in a couple of years, but the fund will live on. Training of accredited technical service providers. In the Philippines, they've got the Department of Environment and Natural Resources, DENR, which maintains a cadre of experts that can help water districts to do things like non-revenue water reduction, etc. And with this Oxfam program, we'll be building their capacity to help local governments figure out their septage management programs. The program that Oxfam is working on will provide 0% loans for 3 years. I've only got 2 minutes, no problem. It's going to encourage repayment through the local ordinance that's guaranteed, and also by sort of the building a camaraderie of the local governments that participate through the League of Municipalities. And this is how the revolving fund works. This is a very simple concept. Basically, the LGU, once they pass their local ordinance, can apply for the funds. They will then use the money to develop the infrastructure, buy the trucks, hire local private sector, possibly, service providers to do the desludging. Then the institutional and the household users will pay their user fee back to the LGU. The LGU then pays their loan payment back up to the revolving fund, and it revolves. So this is what it looks like during the first year. Oxfam's wanting to put about $560,000 into this program. It's enough to get 5 LGUs started the first year, with an average of about $75,000 investment. But remember that these LGUs will be paying back this money, so at the end of the first year, the fund has a balance of almost $250,000, which is enough to start 3 more LGUs the next year and 2 more LGUs the following year, and at the end of year 3, they've got a balance of about $260,000, which is enough to get 3 more LGUs going, and then the fund continues to revolve. So that's Oxfam's idea. I've got 30 seconds left. We just want to thank the key players. This is not a standalone activity, and there's a lot here, actually. It sounds simple, but there's a lot of detail. If you went to that little website there, we've got it all laid out for you, including the toolkit that LGUs can look at to help them figure out exactly what their tariff needs to be sustainable. I hope you checked it out. It's got a lot of good stuff. 10 minutes.
Excellent. Excellent, David. Quick, 2 questions for David. David, please. Right here. 2 questions. Just keep pressing it until you see the signs on it.
Hello.
Yes, please.
The revolving fund concept caught my interest a bit.
Can you hold the mic like this and
Worked with revolving fund before. Just a simple question about, you provide the seed money, and is there any interest involved with the payback, or it is, and then, what is the timeline in terms of grace period or something, etc. Just the mechanics of it.
Okay, wait, one more question and maybe you can take 2 of them there. Yeah. Quick.
Could you describe the LGU in a little bit more detail, and in particular, what are the barriers of entry for them to get the loan? Because obviously they'll have to repay, so there's a question of are they going to repay, are they trustworthy, etc. So what's the barriers of entry for them? Secondly, what's the business model for the third-party administrator? Because if you're charging 0% loan, then you've got a question of what are the operating costs of the third party? Is that grant-based from Oxfam, in which case the revolving fund might come to an end when Oxfam decides not to continue covering the third-party administrator?
Okay, those are great questions. Let's see if I can remember the first one. The interest, right. What was the question? Oh, yes. So the idea with the Oxfam funding is that the interest rate is 0%, but there's an administrative fee of about 3.5% for the private sector, or the third-party administrator. And that also includes the fee that these accredited technical service providers will be charging, because they're consultants. So that's a very good question. The term is 3 years, and there's a 6-month grace period to let things start up a little bit. That was the first part. He had a second part question, or was that? Okay, so yes, for the private sector company, their money is guaranteed by the fees that are passed through the fee schedule in the local ordinance. So every month, that money comes in. It's either a tax or it's added onto the water bill. And the way that this business model is developed is it's got some fudge factor baked in. So it's assuming that only 85% of the people are going to really pay, even though 100% might be billed. And it's also figuring out that only about 70% of the people that are supposed to comply will comply. And it's also based on the fact that any trucking program or sludge collection program will not be 100% effective. There's going to be times when the driver is sick, the truck's got a flat tire or whatever. So we were making in 30% of the time that truck will be not moving. So that being said, when you figured out all of those components, the tariff is really enough to fund the private sector so that they can make a reasonable profit at about 10%. So that's what it looks like right now on paper. Now, this isn't the first time they've done this in the Philippines. There's been a couple very successful models. One is Dumaguete City that has showed that this really does work. Although that's not a private sector, that's the public sector doing it. But they achieved full cost recovery in 4.5 years. And then all the extra money that comes in since then has been going to expand the program and improve the community. Good questions, thank you so much. Will we do it?
Okay. Our next speaker is from Bangladesh, Rajiv Munakan. Now, Rajiv has worked with rural action, technical action. He's worked with a lot of NGOs, but his work is much more community-based. So from a very positive response of how successful it can be in the Philippines, we'll see how it has not worked in Bangladesh and what are the issues and problems. So Rajiv.
Thank you. Today I'm going to share about our preliminary findings of our ongoing assignment in terms of checking the viability of the back-to-back service in one of the city corporations managed by community development committees. Just to give a view of background, under the Urban Partnership for Poverty Reduction project being implemented by UNDP in Bangladesh, under their social economic improvement component, they have provided back-to-back to the community development committees. So in a city corporation area, it's a kind of self-help group, like around 45,000 households. They come, they form a group and it's called Community Development Group. And they do a kind of decentralized planning in terms of what are the requirements in the locality and feeding the planning requirements, needs to the city corporation. And in Khulna City, the City Corporation Conservancy Department is providing a back-to-back service, which has its own complications in terms of access by the community people. So it was thought that if the back-to-back is provided to the community development committees, it will be, it can solve the problem of dislodging. And there were certain assumptions like from the project, like 6 months of salary was provided as a subsidy, and it was thought that within 9 months onwards, it will be self-sustainable with certain assumptions and financial planning. So with this background, as I said, I mean, this is a preliminary finding of our ongoing assignment. So when we talk about Bangladesh, we have been discussing, I think the earlier speakers from Bangladesh has also shared that Bangladesh has done fantastic in terms of access to sanitation and reduction of open defecation. If you see here as well, I mean, in Khulna, open defecation is about 1.3%. It's the data from our baseline. But when it comes to containment, if you see septic tank is around 60% and like around 55, more than 55% of the septic tanks are just a holding tank. They don't have soak well, so it's not functioning as a septic tank. But if we go beyond this, and everything is going to the water body. So unless and until we regulate, like disconnect or make this containment good, the emptying business won't be there. So if we see the manual and mechanical emptying, it's around 20% are being done at this moment. And in this also, manual emptying is more dominant. Mechanical emptying is very less. So when we talk about the fecal sludge management in Bangladesh, if we go into the regulation, it's the responsibility of the local authority. In the city corporation like Khulna, and in Dhaka or the small towns where there is no water and sewerage authority, it's the responsibility of the city corporation, but where there is the cities, where there is WASA, there is an overlap. So it's kind of everybody's responsibility is nobody's responsibility. So I mean, it's kind of not working as expected. I think it doesn't want to move forward. Okay, when we're talking about backup service, it's simply like if my there is no scheduled dislodging. So if my septic tank is filled, I call the backup service provider. They come, they empty the pit, they dispose in the disposal site. In Khulna, there is just a trenching ground. There is no treatment plant. So this is the ideal situation. But in reality, if you see, as in the earlier session also, transport, because of the long hauling distance between the disposal site and the point of intake, these operators tend to dispose to the nearest water body to minimize the distance and also save some cost. So even if we are saying, I mean, the open defecation is reduced to 1%, 2% at the end, and it's again directly going to the water bodies. Now, backup actors, as I said, in Khulna, we have city corporation, community development committees, and like it's being done by manual MTS, yeah, kind of private sector or informal sector. So we did a quick study just to analyze how the existing emptying service can be made more sustainable or viable. So if we see the cost structure, I mean, more than 50% of the expenditure is on salary. And fuel is around 26%. If we see the cost of the emptying, it's around $7.6 a thousand liter from the community development committees. And if you talk about the city corporation, which is very less if we are talking about the per unit volume, but because of the process, I mean, you have to go apply, then you have to go to the bank, pay, then again take the voucher from the bank, then again go to conservancy department. So I mean, the people won't feel comfortable to go through that process. And just to share the income and expenditure within 1 year, and they are in books. But since from the last project they have received some fund, so they are not feeling that they are in loss because they got some lump sum money and they don't see that the money is being depleted. So from our study, the main finding is like the number of vacuum, as I said, the population they are supposed to serve, if they are talking about only their members, is around 4,500 households, but it was also expected that they will serve beyond their community in the city corporation area. So one backup, how much their service they can provide. Then again, the backup model. I mean, the mobility of the vehicle in terms of going to the slum area is an issue. Worker safety, health, occupational health and safety is not still considered in Bangladesh, so that is also one of the major issues we have to deal with. And another, since these community development committees, they are kind of like self-help group, they are not business oriented. So there is always a debate between, I mean, are we a business oriented or a service oriented? So they don't try for the profit. Again, the tariff and the operation cost, 600 taka, around $8, but the expense is way beyond that. But I mean, when we calculate, when we check this with the income, average monthly income of the two low wealth quantile, it's around 7%. But in this, in Pulla, since this is demand-based, they have to pay at once. It's not spread over, and it's not scheduled dislodging, so the cost is not spread over here, so they have to pay at once. There is some, not conflict, but the discussion is ongoing regarding mechanical emptying versus manual emptying. So in mechanical emptying also the manual emptiers are involved, but they feel a threat that because of the coming in of different mechanical instruments, their job may be displaced. Then we have this mechanism of guaranteed proper disposal process. As I showed, I mean, currently, whenever they feel they can, they are disposing wherever they like. So now we are under discussion with the city corporation. I mean, we need to construct at least a short-term treatment option for that, or a secondary transfer station to minimize this. I think I'll stop here. Thank you very much.
Quick, 2 questions. Any? Steve, there.
Yes, just on the, it's not the Mama's coffee type of vacuum truck. I'm just wondering about what's the capital cost of market entry with the, say you've got to buy a truck and the type of vacuum truck, tank management kind of
In Bangladesh, it's also quite interesting. Developed guys here, the DSK. I mean, there's one manufacturer, it's called Mods, who have been producing vacuum trucks since last 10-15 years and are also exporting to other countries. And they have started from MK1 and now they have reached up to MK6, starting from 200 liters, now they have reached to 5,000 liters, 5,000 liters capacity. So at this moment, the picture I showed, the vacuum truck with the ACE, Tata ACE model was around 30 lakhs Tata. And it was provided free by the UPPR project to the CPCs.
Any other quick questions?
What's 30 lakh Taka?
Sorry, the 3 million, it's around 30,000 euro.
30,000 euro. Yeah, one.
35.
Hello. My question is this system demand-based? Are the citizens are going to approach you or?
Yeah, actually at this moment it's on-call service.
Okay. And how this system will compete with the private operators who are disposing it anywhere they want?
Actually, there is no mechanical private operator system. It's manual emptying. Manual emptiers are there. Manual emptying is cheaper, so that's also one of the issue that the vacuum trucks are not being demanded, since the manual emptiers are cheaper. But now, I mean, from the program side and also from the city corporation side, I mean, we have been promoting the vacuum trucks, I mean, the operation of the vacuum trucks, and there we are doing a kind of formative research in terms of what type of information are needed, what type of promotional materials are needed in order to create demand among the citizens.
Thank you.
Okay, I know there are other questions. We'll take them in the final round. Najib. Now invite Najib Lukoya from the Kampala. I'm told now it's called Kampala Capital City Authority. It used to be Kampala City Council in the early days. So Najib is, as you can see from the Director of Public Health and Environment, he's looking at how private sector can be made efficient in the city of Kampala. And he tells me he's also working for PhD at Buko University in Austria.
Thank you so much. This presentation is basically looking at building on a study that we undertook last year, with support from Bill and Melinda Gates Foundation and GFID. Most of the things that you will see in this presentation are quite similar from the African city context, especially in terms of on-site sanitation and sewerage coverage. But what we are looking at here is how can we be able to upscale fecal sludge management, especially pit emptying business at a city scale. So I'll very quickly take you through the current state but most importantly, I will spend more time on what we are proposing to do to ensure that we have an efficient private sector service delivery and environment. This is the city scale, and like you can see, the sewerage service is really limited to the central business district. These are different divisions of the city. It covers only 6%, and therefore the remainder, 94%, is on-site sanitation. Of course, in most of the low-income areas, again, like in other cities, you have pits. Unfortunately, most of them are unlined, and this becomes quite difficult for the private sector to work and the technologies to adopt. But you also have high-income areas where you use the septic tanks. This is kind of the information I've just given, so I won't spend much time on that. These are like again for other cities, the kind of technologies you have from the high end, the vacuum and the galper. This is being promoted by one of our partners, Water for People, and it's working quite well in these low-income areas. To the worst end, then people who have options then go to manual empty. This information is important when you are designing a kind of service regarding fecal sludge empty. Again, I will not talk much about the treatment. These are just, this chart simply shows you what we have. Unlike, I don't remember the city, for us we have wastewater treatment systems. And it just shows you here the emerging technologies also coming up. You realize we are also, for example, trying to pilot sludge incineration for energy production and others. Now, the institutional and operational framework, this is, you don't have to read all that, but this shows the different institutions involved. Here you have the city authority, which is basically in charge of the on-site sanitation, and the private sector down there. So we are looking at strengthening the relationship between the private sector and the city authority in providing an efficient service. Of course, you have other players like the National Water and Sewerage Corporation, which is in charge of the treatment end, the environmental regulatory agencies. Now, this is more of standards, the NGOs who support in terms of capacity building and co-funding in some cases. So this is what we are looking at. And we are drawing lessons from the solid waste system, which is kind of working very well. So we have and operational area. At the moment, you have a block of the city which is unzoned, and the private sector works wherever they want. So what we are proposing to do, which we've done for solid waste, is zoning the city, and where the private sector can be able to operate, and where they are accountable, and where they can achieve contractual obligations. And we do this, implement this using the service level agreement. So these are the different options we looked at. But we think if you have a zone, you have a service level agreement with the city authority. And regarding payment, we think there can be a concession fee between the authority and the private sector. Now, this concession fee depends on how profitable the area is. So the city has been zoned based on low-end and high-income areas. So depending on the zone, then the private sector can be able to say, okay, this zone is profitable, so I can't offer a service fee, or I mean a concession fee, and in that case, the concession fee becomes zero. But we, of course, between the private sector and the households or the users, it is the responsibility of the operator to collect the revenue or the costs. Okay, so basically it is very clear that the demand is very high, and that is good news for the private sector because they have business. And the institutional and operational framework is enabling for the private sector to work. So what we are doing, we are going to do zoning, and we shall have service level agreements. As the urban authority, we shall need to popularize the sanitation, marketing, and of course do the enforcement and regulation. Thank you.
Thank you. Any quick question for Najib? Yes.
Thank you. I'm Aldi from Indonesia. As comments as instructed, it's a very quick question. Have you determined the willingness to pay, how much they're willing to pay for Kampala regions, zones? Thank you.
Thank you. Good question. Yes, I didn't want to present everything here. Willingness to pay, we did. And you find a mix of those that are already paying very high costs and those that are paying low costs. We've done this, and I think it also, we also used it to inform the zoning, so that in each zone you have areas where people can pay a very high cost, and low-income areas where people are kind of will require a cross subsidy to be able to enter. Thank you.
Great. I think let's do a panel in David, Rajiv, Najib. I think that what's emerging is that there is a situation in the low-income areas in Khulna where, despite giving the vacuum tub for free as a grant, the business is not making profit. We have a situation in Kampala where a range of systems exist, right from a high end, as you called, and then Steve's gulpers, and then we have the manual scavenging, and then we have a situation in the Philippines where the whole business model works through the urban local government taxation structure, and so therefore the user interface with the private operator does not exist now. Are there other takeaways? Are there some other questions that you wanted to ask and you did not have time? I think you had a question. Yeah?
Thank you. My name is Hiên. I'm from Miss Quest in Vietnam. My concern is about the second presentation on the financially viable management. So I just wonder about the financial plan. In your report, you said about 62% for salary and another 13% for O&M. And look at the financial statement. So the physics is about 32,000, as I remember. I'm not sure, but about 32,000 per year. So I just wonder, can you share with us your strategy plan for the sustainability of this model? Yeah.
Got the question?
At this moment, we have not really started interventions. As I said, this is the preliminary findings of our ongoing assignment. So we are under discussion with the vacuum operators, how we can save. Like if you talk about the salary, even if there is no work, they have to pay salary. So when we talk with the executive committee of the CTC, the committees, they came up with the idea, why don't we pay per service? If they go out to empty, then per trip, the driver and the operator will get. Rather than, just in one of the months, if you see, they did only one trip, but they have to pay the salary. And another is regarding, we are also discussing with the city corporation, the local authority, in order to explore the possibilities of establishment of secondary transfer station, whether it can be fixed or kind of mobile lab. The current vacuums are just 500 liters. So every time that they have to travel two-way around 20 kilometers to dispose that 500 liters worth. So in that case, if we can minimize that transport by having, let's say in the city corporation, they have a tanker of 4,000 liters. So instead of having a fixed transfer station as well, if those small vacuums can dump into a mobile tanker, which is 4,000 liters, so only one large tanker with 8 loads of small vacuums can travel. So there are different possibilities. So at this moment, but I don't have the figures, but we are exploring the possibility how to make it more viable.
Thank you. There was a question from there, and then at the end. Yeah, please, go on.
Yeah. It's a reflection, basically thinking at the three presentations. Thank you for the presentations. I'm thinking how often, because the technology is in a country, then that becomes the default solution. So in Bangladesh, VacuTurk was introduced, and it's VacuTurk forever. It's almost equally emptying, right? And in Philippines, it would never be VacuTurks, it would always be big tankers maybe. I don't know if the Gulf becomes the default solution. My question is, how can we compare better? Because as moderator you were comparing, but I think we should compare really the performance in terms of health and safety of emptying, whether it's dumped in the right place and so on. And from Kampala, I haven't heard so much about health and safety, or whether it's dumped in the right place. From Philippines, I assume there's health and safety standards and it's dumped in the right place. And Rajiv, maybe you could say a little bit more about it.
Yeah, okay. Since you mentioned the moderator, given that this is a business session, I was talking about the money aspect, but yes, the other things are important. What I'm going to request is, I see many hands, so if you could please take a few notes. There was a gentleman at the back of the room, and
as we are talking sludge management, the project, and my question for the Oxfam project here, does it stop after collecting the sludge? Is there any utilization, any sustainable management plans anywhere of these projects? I would like to hear what are the next steps with all three projects.
okay, good question. At the front end.
normally when we think about fecal sludge management in developing country, it's not just simple. For example, in the case of Kampala, for example, 90% of the people cannot afford to fulfill their basic needs. And in such cases, trying to privatize the fecal sludge management is unthinkable. And I think what we are talking is very ideal and theoretical. We have to think about the income and the status of the economic status of the people if we want to implement realistic fecal sludge management. Otherwise, it will be just simple.
Okay, good point. Maybe we'll just ask the panelists to respond one by one, but I would finally respond to your comment.
Okay, I'll start with Antoinette's comment. One thing about the health and safety and the Philippines, are they dumping it in the right place? I'll mention one of the things that's very nice about these organized desludging programs where people pay a fee. The desludger doesn't get paid until he brings, or she, brings the load to the plant and gets credit for that load. Now, there's one more point there, is that when they are paid based on the volume, that's an added incentive for the desludger to get all of it, or as much as they can, because that's money in their pocket. You know, instead of just dumping the hose in the tank and sucking out the liquids and leaving the solids behind, which is very common. The other point that Antoinette raised was, how do we know it's the best alternative? Is line stabilization always going to be the answer? Well, I think that what the answer is you really have to do a cost-benefit analysis for a bunch of technologies, a bunch of different kinds of trucks. You're looking at the longevity of the equipment, how easy is it to operate, how easy is it going to be to repair, to maintain, et cetera, et cetera. There's a lot of criteria, and you really need to consider everything, because in the end, you know, you're going to have to face pretty tough questions when people a year or two later do this. How come you chose that technology? So do your homework. Does it stop after the collecting of the sludge? I'll just go ahead and well, yeah, that's a very good point, because what Sally Soils or Sally Sludge mentioned earlier today, I don't know if she's here, what is really true is that, you know, this fecal waste is excellent material for growing, for repairing the soils that we have so damaged. But that being said, in the Philippines at least, that waste doesn't have much value. Dumaguete is the model that I'm very familiar with, and there, they can give away that waste, but people aren't buying it, to the best of my knowledge. The city is using it for some greening programs. They are planting 1 million trees a year and doing it like that. So it's got value, but I think that more education on the real value there is necessary to realize that value. And then the third point is on the affordability, that's totally correct. If it's not perceived to be affordable, people won't, you know, they won't avail of the service. So what we're trying to do is, there's this universal figure of 5% for water supply and sanitation. If you can keep your fees below that magical number, I don't really know if it's valid or not. In the Philippines, with the program that I outlined there, we're about 2.8% on these Oxfam programs. These seem to be relatively affordable. But maybe the Philippines has a little bit higher income than these other countries. I think that's definitely the case. So these guys will have to answer for themselves.
Thank you.
Thank you so much. I'll begin with the issue of health and safety. Again, he has already mentioned one strong point, but in Kampala we've also done two, I think, fundamental turnaround steps that have strengthened the issue of safety, health and safety regarding fecal sludge, emptying, collection and transport. One, you want to bridge the gap between the regulators and the private sector. So this partnership is very important so that you can be able to work together, you can be able to plan together, and going forward, you can also be able to control the illegal discharge. And secondly, you want the private sector players to also work together among themselves. So in Kampala, for example, they have an association, and this helps to do self-monitoring, because they can then be able to regulate, to monitor themselves, and also be able to have the penalties. And I'll comment on his.
Next moderator is waiting.
Yeah, he gave a case of Kampala the low income being realistic for all these emptying fields. Yes, but we also did a comprehensive study in Kampala, and we realized that it is actually also sometimes about prioritization of the household. For example, in Kampala, you find even the poor of the poorest having a mobile phone, and they use airtime every day. So it is all about priority. They can be able to pay. Thanks.
Let me respond with health and safety. Like when we started working with the manual emptiers and the vacuum dog operators, when we discuss with them, they are not putting health as the primary issue. When we told them, why don't you wear gloves or masks, they said, it gets so suffocated. I can't work with hand gloves. They are so habituated with, working. If you add it, we have been discussing with them, it costs just 5 taka, which is less than 1 cent. And if the user is paying 600 taka, and adding 5 cents is not going to be a huge burden for the end user. But from our program with the city corporation, we have been developing a occupational health and safety guideline for the manual and mechanical emptiers. So within, I think, end of this quarter, the guideline will be finalized. As far as the serving the poorest, in the city corporation as well, sometimes it gets kind of political tariff saying that, okay, the poorest will be served as free. But that's, but we have been discussing, we need to work on a smart tariff. But it needs to be worked out with the city authority and also the utility and the community, depending upon their income status, kind of cross-subsidize among the tariffs, different tariffs for the different income groups. Thank you.
Yeah, excellent. I think we're really running out of time. I think this was the last of the FSM business sessions. Throughout the day, we've discussed range of issues. The key point really is what are the various business models that exist, the user pay, the taxation base, the demand base versus regulated systems, what Rajiv was just talking about in terms of affordability. Do we talk about cross subsidies or do we really talk about free service to the poor? I think range of these models exist. We really need to contextualize them in the situation in which we work. Some models may work in one context and may not work in the other. But I hope there are enough takeaways, and I hope that on the last day of the conference you will have 3 takeaways from, I think, the whole day's session. So we don't really have time to discuss those takeaways, but thank you all. Let me join me in thanking the 3 panelists and everybody. Yeah, it's all yours now.